name's Alex Clark. I'm one of the midwives here at the Sydney Adventist Hospital. Today I'll be talking to you about the normal characteristics of a newborn baby, which otherwise may seem daunting as a new parent. Congratulations first off on becoming a parent. Shortly after the birth of your newborn baby, a midwife, paediatrician or obstetrician will conduct an assessment on your baby from head to toe. We'll be looking for any abnormalities that may be present at birth. One of the first and most obvious characteristics you may notice about your newborn baby initially is the shape of your baby's head. It is normal and common for the baby's head to be misshaped and slightly elongated after birth. This is often due from the baby's head being pushed through the birth canal. The bones of the baby's skull are forced together, reducing the diameter of the baby's head so that it may pass more easily through the birth canal and pelvis. This is known as moulding and often resolves after the first few hours to a day after the baby is born. Another reason for an elongated or misshaped head could be due to an assisted delivery at birth. This is where a suction cap or vacuum is placed on the baby's head to assist with the baby's head being delivered. This suction may leave a more pronounced elongation of the baby's head where it is connected, but it will reduce over the first few days. After the first few hours of birth, these cranial bones move back into normal alignment. There are, however, two areas that are left uncovered and soft at the front and the back of the baby's head. These are known as fontanelles. There are two types of fontanelles and are often referred to as soft spots. The anterior fontanelle is larger in size and at the front of the baby's head and can often be noted to be pulsing, bulging, or even dipping. This is very normal. The posterior fontanelle is at the back of the baby's head and is often smaller in size and reduced in size a lot quicker. It is also possible for your baby to be born with swelling to the top of its head. This is often from the baby's head being pushed against the cervix or during a prolonged labour. This is known as caput and will reduce over the first few days to a week after birth. Alternatively, this swelling could be what is known as a Kefler hematoma. This is a small collection of blood under the baby's skin that is often from a prolonged labour or a traumatic delivery. This will also reduce and be reabsorbed by the body over the first few weeks after birth. Moving to your baby's face. It is not uncommon for your baby's eyes to be puffy or watery. This could be from a blocked tear duct and will resolve over the first few days. Also, you may notice redness in the baby's white of its eyes. This is often from pressure during delivery. The ears of your baby are often very soft and could be folded over at birth. This will resolve over the first few days. You may notice white spots on your baby's nose or cheeks. This is known as milia. These are blocked sweat or oil ducts and will resolve over the first few days. You may also notice your baby sneezing or snuffling. This is very common, especially after a cesarean section where there is a lot of amniotic fluid trapped in the sinuses. Your baby will get this out on its own and does not require any treatment. It is very common for the baby's nipples, male or females, to be swollen, as well as their genitals in both sex. This is often from maternal hormones being passed to the baby. This will resolve over the first week or two and is not a concern. In female infants, it is not uncommon to notice a slight watery or even pinky discharge from their vagina, as well as some possible spot bleeding. This is also from passing of maternal hormones. The skin of your baby is very delicate, and you may notice its face becoming red very easily. This is due to the lack of fat subcutaneously in the baby's face, and the capillaries being very close to the surface. It is not a concern, and as your baby puts on weight, the redness in its cheeks will fade. At the birth of your child, you may notice a thick, white, creamy substance on the baby's skin. This is known as vernix. It is secreted in utero to help protect the baby's skin against the amniotic fluid and acts like a moisturizer. A day or two after birth, many babies develop dry skin, predominantly on their hands and feet. This is normal and does not require any treatment. Your baby may develop a red blotchy rash, either on its face or on its back or chest. This is known as erythema toxicum. It does not require any treatment and will disappear or fade on its own. A Mongolian spot is characterized by a dark blue or even grey spot found on the baby's buttocks, lower back or shoulders, and is more common in babies of ethnic descent. It is not a concern, it does not hurt the baby, and it will disappear over the first 18 months. Birthmarks or stork bites, often flattened red or pinky areas found on the baby's forehead or back of the neck, will disappear over the first 18 months and are very normal to see in Caucasian babies. Sucking blisters are noticeable blisters on their hands, wrists and arms of the baby. This is often from baby sucking on its hands, wrists or arms in utero and is not a concern, do not hurt the baby and will heal very quickly. Bluish purpley hands and feet on a newborn baby is very common and is known as acrocytosis. This is from the baby supplying blood to its vital organs rather than its peripheral limbs. It is normal to notice a fine black hair on your baby's back, shoulders or ears. This is known as laguno and will disappear over the first few weeks. Your baby may develop a yellowish tint to its skin. This is known as jaundice and is very common. It is found in about 50% of babies. Your baby will be monitored and checked every day by your midwife, and if they are concerned, they will notify the pediatrician. There is a simple non-invasive test that can be done to monitor the level of jaundice in your baby. The treatment of your jaundiced baby is often increased feeding and possibly phototherapy in special care nursery, where your baby will stay for a short amount of time under some ultraviolet lights to reduce the jaundice in its skin. At birth, the umbilical cord is cut and a clamp is applied at about 2 to 3 centimeters from your baby's abdomen. This clamp is removed after 24 hours once the umbilical cord starts to dry out. It is normal to notice a small amount of ooze coming from your baby's umbilical cord before it falls off. You may notice a small amount of ooze from your baby's umbilical cord over the first few days, and even maybe some spot bleeding when possibly knocked by nappy changing. Your midwife should show you how to care and clean the umbilical cord for the first few days until it falls off. Your baby's bowel motions will change significantly during the first few days. The first bowel motion we notice is called meconium. This is very dark and green in colour. After that, the baby's bowel motion turns more a mustardy colour with a cottage cheese-like consistency. It is very common to notice your baby's feet slightly turned inwards. This is called talipes. It is also common to notice bowing of your baby's legs. This is often from the baby being curled up in utero. This often resolves on its own over the first few weeks. However, there may be mild treatment required to straighten the legs or feet. Your pediatrician will talk to you about this during your stay. Most of these characteristics are very normal and common. However, if you are concerned at all about any characteristics your baby may have, please mention it to your midwife or pediatrician so that they can investigate further.